Okay, so we're going to go over how to properly fit bands on teeth. So first of all, when the patient comes, there should be a separator, mesial and distal, to the tooth that you're going to fit the band on. And you want to take those separators out first. So to take them out, you get your scaler or your explorer and you sneak it up under the edge like this. And then I usually put my thumb over it like that as I pull, because as it snaps loose, you can kind of catch it and keep it on there. If you don't put your thumb there, it can fling it. It'll like shoot it like a rubber band. So you take that out. There was just one on the mesial for this patient. Sometimes these will fall out, and that's pretty normal, but you just want to make sure that that separator is out of there, because sometimes if they chew on stuff, it can push it down under the contact and be down here in the gum tissue. So you just want to make sure that you check and make sure it's not like hidden under the gums. If you have any questions about that, just ask the doctor to come take a look, and he or she can take a look for you and make sure that they're not down in there in the gums. So once you get the separators out, to fit bands, you'll need, first of all, an assortment of bands. We have a band cart. You'll need a bite stick like this. You'll need a pusher like that. And you'll need a band removing plier like this. So first of all, you take a look and you kind of make an educated guess at first to say what size this is going to be. So I'm going to guess that this is going to be a size 12. And so here's what the band looks like. It's just a steel ring that goes around the tooth. Some bands have brackets on them like this, and some bands have no brackets on them, and those are called bracketless bands. This one has a bracket on it. And you want to make sure that you fit the correct kind of band, whether it's a bracketed or bracketless. It should say in the chart, but if you have any questions, just ask the doctor. And these should be labeled. So you'll see right here that says LR12. That stands for lower right, size 12. So what you do, this hook should go gingival and distal. So you'd put it on like this. So what you do first is you try on the first band. So you'll have it like this, and you just try to push it on with your thumb. Now I'm trying to push it on, and this one is too small. It won't go on. And it's not super close. It's not barely going on. So I know I'm not super close. So instead of going to a 13, then a 14, then a 15, then a 16, what I'm going to do, this is a 12, I'm going to jump to a 15 and try a 15. Because each of these that you try on in the mouth, you then have to run through sterilization and then restock them. So the fewer of these you can get dirty, the less work it is to clean them all up later. So I'm going to jump to a 15 and try that. So here's a size 15. As you can see, it says LR15, lower right 15. So I'm going to try that on. So I position it. Now when you fit the band, you want the mesial of the bracket to be in line with the cusp, the mesiofacial cusp, or the mesiobuccal cusp of that molar. So the mesial of that bracket should be in line with the mesiobuccal cusp, about like that, so that it's not rotated back here or way up here on the mesial. So I'm going to try to fit this on here, and I try to push it on with my thumb. Now I can start it on there, but I look and the tooth swells, the tooth kind of widens out right down here, and that band is just not going to go on there. It's just a little bit too small. And so I'm going to jump to a 17. Instead of going to a 16, I'm going to jump to a 17. So this is on there kind of tight. So if you can get it off with your fingers, then go for it. If you can get it off with a scaler, that works too. But if you need to, you get your band removing plier out here. So the band removing plier works like this. You want to put this padded plastic part on the biting surface so that it's inside the ring, not over the edge of the ring, or the band, pardon me. And then you get the jaw under the edge, and when you squeeze the plier, it should lift up like that. Now what I usually do, this right here where it solders, or where it's tack welded right here, you can get that as well, like to grab that with the jaw. And then I'll just lift up gently, and then you can kind of get a hold of it and just be very gentle. What you do not want to do is grab onto this and squeeze for all you're worth, because what can happen is you'll bend this, you'll crush the band, and that's no good. So try to be gentle, try to like tease it off nice and gently so you don't distort the band and ruin it. So next I'm going to try a size 17. So here you can see a lower right 17 band. So I'm going to position it so rotationally it's correct. The mesial of that bracket is lining up with the mesial buccal cusp tip. I'm going to push it on with my fingers. Now if you can completely seat it and it's like sloppy on there, then that's too big and you need to drop back in size. But this is fitting just about right. So I can get it on there most of the way with my fingers, and then you can either seat it the rest of the way with the band pusher, or you can use the bite stick. So if you're going to use the band pusher, you would put this on here so that the band pusher overlaps the band and the mesial or distal marginal ridge. These are the marginal ridges, or this is the mesial marginal ridge. It's like a ridge of the tooth right here. Here's the distal marginal ridge. It's this ridge of the tooth right here, between the cusps, this part. So if you were going to use the pusher, you would go over the top of that marginal ridge and over the band, and you'd push down, and that marginal ridge will stop you. So the goal is you want this mesial part of the band and the distal part of the band to be level with the mesial and distal marginal ridges respectively. So you can achieve that by pushing down, and the marginal ridge will stop you, and then they'll be nice and level. Alternatively, you can use the bite stick. This is what most of our staff will use. So the way you use this triangle piece right here is metal, and then you position that on the band like this so that it's over the band but not over the tooth. So it's just like on the edge of the band. If you put it over the tooth and then have them bite, all of that pressure is pushing down with a metal surface on the tooth, and it can chip or crack the tooth, and you don't want that. So just make sure it's over the edge of the band but not over the tooth, and then you have the patient bite. So I'm going to simulate that by pushing down with my thumb here. Now I personally place this on the corners. So I'll put it like this for the mesial buccal corner. I'll put it like this for the mesiolingual corner, like this, or like this for the distolingual or distopalatal corner, and then like this for the distobuccal. And again, just make sure it's not over the tooth. So I usually work on the corners because I find that helps me seat it down well. Some people go on over the bracket and then over the lingual surface, but I find that does not work it down as well as working on the corners. You find what works best for you, but that's what works well for me. So once it's seated down so that it's level vertically with the mesial and distal marginal ridges, and I'm of course showing it with my thumb, but the patient will bite. Now sometimes patients are very scared and they'll touch this with their tooth, but they won't bite hard enough to push it down, and you just have to encourage them to bite hard enough to push it onto the tooth, and you can figure out your favorite way for encouraging the patient to do that. I usually say, okay, bite, 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 hard, 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 bite, 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 hard, hard, and that usually works. If they're a kid who just will not bite, I'll just explain, okay, we need to push this up onto the tooth, and we can do that by either you biting on here hard enough for it to push it up onto the tooth, or I have to push it on with my hands. And it's usually easier and more comfortable if you bite it on there. And almost always that will get the most scared kids to do it. But you got to do what you got to do to get it on there. So then once it's flush with the mesial and distal marginal ridge, you want to make sure that the outline of the band matches the outline of the tooth. So you'll see this is pretty good right in here. Over here you'll see we've got kind of a gap right here. So what you'll do is adapt to the band, and you'll get the pusher and you'll put it in here like this, and then I won't push with the hand that I'm holding the pusher with, or the instrument with. I will push with the opposite thumb. And the reason I do that is I have much more control this way. So what I'll do in the mouth is I'll actually hold this side of the tooth and then push with this finger, or vice versa. If it's on this side, I would hold it with this hand and push with my thumb. Now the reason I do that, it gives me a lot more control. I can't like slip off and gouge the patient. If I'm pushing with this hand, it could slip off and you could hit the patient's lip or cheek or tongue and hurt them. You don't want that. So I'll hold my thumb here and I'll push with my finger here, and you have to push hard enough to bend that metal band. So you push, and the patient will sometimes cringe when you're pushing, because if they're scared, any pressure will be interpreted as pain. And so just say, okay, I'm going to give this a little push just to help it shape to the size and shape of your teeth. And you push it in on the sides like this so that it matches that contour. And then you can do the same thing over here on this side if you need to. And you'll see like right here, there's a little bit of a gap. So I'm going to adapt that in there, just like that. Bam. Okay, so now that matches the shape of the tooth, and you're good to go. So now that it's sized and shaped correctly, you call the doctor over, make sure that he or she is happy with the size and fit of the band, and then you take it off. So again, you take it off by getting this up under the edge. I use that tack weld usually, and I'll just gently lift, and sometimes you gotta lift from this side and then come around here and lift from the other side. And again, the idea is to be very gentle and just kind of tease it off so that you're not crushing or bending the band. And I'll sometimes get a hold of it, and then the last little bit, I'll just kind of wiggle the band removing plier, and it should come off. And then I squeeze it like this, and you'll see it falls on the jaws, and it won't fall down their throat, and they won't swallow it. And then I bring it out of the mouth. And that's how you fit a band.